Okay, just a quick video to talk about joints, joint classifications, joint structures. So overall, we can break the joints, or articulations as it's sometimes called, down into three broad categories. The first one being fibrous, where two bones join together by tough fibrous connective tissue and we don't get a lot of movement as a result. So sometimes called immovable. So our man here, all the separate bones of the cranium joined together by sutures, which are a type of fibrous or immovable joint. Another one, we've got these joints between tibia and fibula, gap on the skeleton here. We've got tough fibrous connective tissues in between those, and the same again between radius and ulna, except our man here doesn't have any. So that's syndesmoses. Okay, after that, next classification, cartilaginous. All right, bones are connected by a layer of cartilage. Cartilage, we've talked about, it's a bit squishy, so you've got a bit more movement in there. So we have got synchondroses, which we talked about a lot. In between the vertebral columns, you've got your intervertebral discs, each one allowing a slight movement, but altogether we get a bigger degree of movement. And we've got pubic symphysis there, joint in between the two pubic bones, allowing some movement, particularly more important when it comes to childbirth in women. All the other joints, synovial joints, are freely movable joints, and there's loads of different types of those, okay? I'll do another video to talk about those, but the knee, the ankle, the hip, mostly the stuff we're going to talk about when it comes to human movement. The big thing with synovial joints, whilst several different subgroups of them, they share some of the same structural points. So we've got a little knee joint here. You can't see everything on there. Key thing here, articular cartilage. Layer of cartilage covering the bone, lubricates the joint, acts as a shock absorber. The joint meets in a capsule, so we've got some sort of movement in there. We've got a range of ligaments adding stability, so we can see the collateral ligaments on the outside. Just in the middle there of the knee joint, we've got the cruciate ligaments, anterior, posterior. The cavity in the middle here, this will be full of synovial fluid. Synovial fluid nourishes the joint, provides lubricant. It's viscous when cold, becomes a lot thinner when warmed up, allowing freedom of movement. That synovial fluid produced by a synovial membrane which lines the cavity, and can't really see it on this knee joint, but certain joints, or we probably can round the back here, we can see we've got these extra layers. We'll just adjust there. Extra layers of cartilage, fibrous cartilage discs providing additional padding and cushioning there. That's your meniscus. All right, particularly the knee needs those because you've got a huge amount of force, your full body weight coming down on your knee joint with each time. So we want as much cushioning as we can to protect the bones involved. All right, that's that.